Diabetes Family Education. Understanding Screening for Long-Term Complications for Youth Living with Type 2 Diabetes by the Diabetes Education Program at the Hospital for Sick Children. This resource looks at screening for long-term complications for people living with Type 2 diabetes. Please note, the images in this resource are for illustrative purposes only and do not constitute the hospital's endorsement of a specific brand or product. If blood sugar levels are high for extended periods of time, people living with diabetes become more at risk for having damage to small and large blood vessels. You will not have control over some of the risk factors, but many can be managed to reduce complications. Risk factors include, but are not limited to, having consistently high blood sugar levels, length of time living with diabetes, smoking, having high blood pressure, hypertension, having high cholesterol and blood fats, dyslipidemia, being overweight, and being inactive. These risk factors can cause changes to heart vessels, circulation to the limbs, vision, kidney function, and nerve function. It is important that screening tests are done to monitor any changes in these areas and, if needed, provide care to prevent the progression of these complications. Screening tests for changes to heart vessels include measuring blood pressure. This test is done at least twice a year and checks for high blood pressure. Venipuncture, blood draw. This blood test is done once a year and checks for dyslipidemia, an abnormal level of cholesterol and fats in the blood. Screening tests to look at changes to the circulation to the limbs start in adult care if there are symptoms. Screening tests to look at changes in vision include eye checkups with an optometrist in your community. It is done yearly, starting when you are first diagnosed with type 2 diabetes. Screening tests to look at changes in kidney function include urine tests. They are done yearly, starting when you are first diagnosed with type 2 diabetes. Screening tests to look at changes in nerve function include questions and a physical exam. These will help identify neuropathy or nerve damage. It is done through yearly screening starting when you are first diagnosed with type 2 diabetes. Screening for changes that can happen related to your diabetes is an important part of your ongoing care. Working with your team to try to maintain your A1C as close to target range as possible makes a difference and will help to keep you healthy. Diabetes research is ongoing, and future management innovations will continue to improve long-term health outcomes and the quality of life of those living with diabetes. We are here to help. If you have questions or need further tips, please contact your diabetes team.